Medicare Advantage plans, also known as Part C of Medicare, can be a pretty polarizing topic. You're going to find people, some right here on YouTube, that hate Medicare Advantage plans. Other people love Medicare Advantage plans. But the fact of the matter is that over half of seniors on Medicare will end up with a Medicare Advantage plan. So today I want to break down exactly what is a Medicare Advantage plan, how does it work, so that you can make the most educated decision about your Medicare needs. So stay tuned. Medicare Advantage plans are also known as Part C of Medicare. These are an optional, kind of all-in-one way to receive your Medicare benefits. And before I dive into the specifics, I just want to state that these plans are a good fit for some people. They are not a good fit for everyone. Here in my office, we help people with all different types of Medicare plans. So I'm going to try to give as unbiased a review of Medicare Advantage plans as possible today. So in order to enroll in a Medicare Advantage plan, you have to be enrolled in both Parts A and B of Medicare. Now, when you choose to enroll in a Medicare Advantage plan, you're still enrolled in Medicare Parts A and B. You still have to pay your Part B premium. But when you enroll in a Medicare Advantage plan, now your medical coverage is handled by that Medicare Advantage plan insurance company, not by the government. Most Medicare Advantage plans include Part A hospital coverage benefits, Part B medical coverage benefits, and usually Part D prescription drug coverage rolled right into the plan. Now, some plans are even going to offer additional benefits, things like a gym membership benefit, or maybe some dental or vision or hearing coverage will often be rolled into that Medicare Advantage plan. And in most parts of the country, Medicare Advantage plans are $0 a month, or they start at $0 a month in most areas. So they can be a very attractive way for seniors to receive their Medicare benefits. Now, Medicare Advantage plans are managed care plans. Most plans are HMO or PPO type plans. That means that you have to work with a network of doctors and hospitals. If you have an HMO plan, you generally have to stay in the network. There's no coverage outside of the network unless it's an emergency. And on a PPO plan, you usually have coverage both in and out of network, but you generally pay more for out-of-network services. On an HMO plan, you're usually going to need referrals if you want to see a specialist, and Medicare Advantage plans set their own copays, deductibles, and co-insurance amounts that you're going to pay when you use the plan. Now, how can these plans be $0 a month? Well, the Medicare Advantage plan, remember now, is the one managing your care, not the federal government Medicare program, right? The Medicare program's now off the hook for your medical care. And because of that, the government pays the Medicare Advantage plan insurance company to manage your care. So the Medicare Advantage insurance companies are getting paid from the federal government for each Medicare beneficiary that they enroll. Now, I have another video that goes into more depth about how these plans are $0 a month and exactly how these Medicare Advantage insurance companies are getting paid from the federal government. But essentially what you need to know is that in most cases, you'll have to continue to pay your Part B premium. But if you enroll in a Medicare Advantage plan, you'll often have no additional monthly premium on top of that. Also, like I mentioned before, you'll have to pay set co-pays, co-insurance, and deductible amounts for given services. And that can vary a lot from one Medicare Advantage plan to another. Additionally, Medicare Advantage plans come with an annual medical out-of-pocket maximum, so kind of like a cap. On traditional Medicare Parts A and B, if you have no other supplemental coverage, there's no cap on your potential out-of-pocket medical spending. But on a Medicare Advantage plan, you do have an out-of-pocket maximum cap, which resets each calendar year for covered medical services. Basically, the out-of-pocket maximum is the total amount that you may have to pay in co-pays, co-insurance, and deductibles before the Medicare Advantage plan will kick in and pay 100% of your covered services. So how do you know if a Medicare Advantage plan is right for you? Well, a Medicare Advantage plan may be a good option to consider if you are someone who wants all-in-one Medicare coverage at a low monthly cost that includes prescription drug coverage. If you like having extra benefits like dental and vision built in at no extra cost, if you're pretty healthy and you just want to keep your monthly premium costs low, and if you don't mind using a set network of doctors and hospitals, then you may want to consider looking at Medicare Advantage plans. A Medicare Advantage plan may not be a good fit for you if you are someone who travels very frequently. Medicare Advantage plans are typically regional plans, meaning they may or may not work if you're traveling outside of your plan's set coverage region. If you have complex health needs or you have the potential for complex health needs and you may want to have the freedom to choose any type of specialist in the future, then a Medicare Advantage plan may not be the right fit for you. Also, if you don't like the idea of needing things like prior authorization or certain network restrictions, then you may want to consider other options besides Medicare Advantage. Most Medicare Advantage plans do require prior authorization for certain more major medical services, and Medicare Advantage plans do require more prior authorization than, say, traditional Medicare does. Additionally, Medicare Advantage plans are calendar year contract plans, meaning that the plan and the plan benefits can change every January 1st. So when you enroll in a plan, essentially you're enrolling in a plan that will be good for that year. And from year to year, the plan can change sometimes substantially, or the plan could be discontinued altogether. So keep in mind, if you're choosing a plan because it has a great dental benefit, that dental benefit may or may not be the same next year. Additionally, if you're choosing a plan that has all of your doctors in the network, that can change as well in the future. Doctors can come in and out of the network. So if you do want to go with a Medicare Advantage plan, it is important to look for your annual notice of change document that comes to you in the mail every fall. It's also very important to shop around with your agent or broker that you trust that can look at all of the different plan options in your area from year to year. Now, I mentioned earlier that Medicare Advantage plans can be polarizing. Now, agents and brokers in general get paid more to sell Medicare Advantage plans than they do Medicare supplement plans in most situations. So you will find a lot of agents and brokers out there that are really strongly pushing Medicare Advantage plans, and they won't even really explain to you the other options that you have, like say Medicare supplement plans as an alternative. Alternatively, there are other agents and brokers who hate Medicare Advantage plans. They don't get contracted with them. They don't do the special licensing that it's required to sell Medicare Advantage plans. And they often use strong fear tactics to drive their clients away from Medicare Advantage plans altogether. Now, the truth is that Medicare Advantage plans are a very popular way for seniors to receive their Medicare coverage. They are not going to be the right fit for everyone. If you're someone that needs a lot of medical care and you like to see certain specialists, a Medicare Advantage plan may not be the best overall fit for you. But there are also many people, including many clients of ours, that have Medicare Advantage plans. They've had an Advantage plan for many years. They love it. Even when they have a year where they need substantial medical care, it still worked out great for them. So they are not all bad. What I will say is that not all Medicare Advantage plans are created equally. There are certain plans that are going to give you much more freedom than other plans. There are certain plans that are going to have fewer prior authorization requests, fewer claims denials than other types of plans. So again, it's important to work with someone who's very knowledgeable about these options and that can really point you in the right direction on the best plan for your needs. Not all seniors realize that when you are turning 65, the choice you make of whether to go with traditional Medicare and a Medicare supplement plan or a Medicare Advantage plan is a very heavy choice. It can have lots of implications for your future coverage, especially depending upon where you live. Because in some situations, if you have a Medicare Advantage plan and then later on down the road you want to switch over and get a Medicare supplement plan, you may not be able to. It could be dependent upon your health. So again, it's very important to get fully educated about how these plans work and what your different options are. So to break it down and summarize and simplify, Medicare Advantage plans can be a good fit for some. These plans are often 0 $0 a month. They usually include prescription drug coverage. They usually include extra benefits, think gym membership benefit, sometimes dental or vision benefits, and you have a set medical out-of-pocket maximum there to help protect you against catastrophic medical bills. On the downside, these plans do have network restrictions. Not every doctor is going to take your plan, and these plans usually don't travel with you. You may need referrals to see a specialist, and the costs can add up. If you have a plan that has pretty high copays for things like hospital stays, surgeries, office visits, you can have high medical costs depending on the services you need. Additionally, your coverage can change every single year, so you may need to shop your plan every year. Keep in mind that here in my office, we help people with both Medicare Advantage plans and Medicare Supplement plans. We work with over 30 different insurance companies. We are licensed in 48 states, and my agents and I would love the opportunity to assist you if you would like more information about the best plans out there for your needs. I hope this video was helpful. Please like the video, subscribe if you haven't done so yet, leave all of your questions and comments for me below, and share your experience with Medicare Advantage. If you have had a Medicare Advantage plan, whether you've loved it, hated it, or you know someone who has had one that has had an experience that's worth sharing, please leave it in the comments below. It's really helpful for other people that are considering different Medicare Advantage plans to hear about that. Thanks so much for being here, and we'll see you soon.